I'm watching the transmission every day.
Jessica Meyer of Covington is once again paying close attention to statements like this from Kentucky Governor Andy Beshear.
And we are at a critical stage all across Kentucky. We have multiple hospitals bursting at the seams.
That kind of alarming language makes Meyer feel more grateful than ever to be vaccinated against COVID-19. It also makes her wonder why some people still refuse.
It pains me to see other people that aren't able to or not willing to, just because I think it would make a huge difference to get us back to where we used to be.
Current hospitalization rates at St. Elizabeth suggest northern Kentucky is nowhere near where it used to be. A spokesman says more than 90% of the hospital network's beds are full, with the ICU at more than 80% capacity. Most of the patients at St. E are infected with COVID-19. It's sobering news that worries medical experts in Cincinnati.
We know that the Delta variant can infect, one person sick can infect up to 8 people. And so we're just seeing greater transmission rates in environments where folks are hanging out.
Kate Schroeder with the Health Collaborative hopes people on both sides of the river pay attention to health data that shows COVID vaccines are working.
What we've seen in Ohio of the thousands and thousands of cases, 98% of the hospitalizations and 99% of the deaths are among those who are unvaccinated.
It's a point not lost on Jessica Meyer.
I would say please trust the science, get vaccinated.
Now back here at St. Elizabeth, officials are aware that Governor Andy Beshear has asked for the federal government to help out in the form of sending medical strike teams. That kind of assistance is not needed here, according to a spokesman. That's because St. E has enough workers and other jobs who could shift around and switch to patient care if necessary. Reporting live tonight, Todd Dykes, WLWT News 5.
Todd, there is no longer a mask mandate in Kentucky. Are St. E officials worried about sick people not wearing masks?
Ashley, that is a very real concern. There's fear that there could be a perfect storm of regular seasonal illnesses like the flu or respiratory illness or, say, pneumonia could collide with patients who have COVID-19, may not realize it, aren't wearing a mask, and then that would just be a real problem. And officials here at St. E are worried that that kind of storm could send their case counts through the roof. Ashley?
All right, thank you, Todd.